Hi, welcome back. No, this isn't the same video I posted last time. Medicare threw a little loop in there. They brought up the plans for 2020, which is good. We wanted that to happen. But they threw out the old plan comparison tool. And my last video, if you saw that, I'll try to post it up here if you want to check it out again. It was pretty long, and a large part of it was going through that plan comparison tool. So I thought, well, since they updated it now, it's probably a good time to get back and look at the new one, show you how to use that. This video is not going to break into a lot of detail about the differences in the different types of plans. The last video is still there. It breaks those down if you want to watch it. This video is just going to be a shorter one, show you how to use the new plan comparison tool, hopefully help you pick a plan. Alright, so go, if you got your computers, Medicare.gov, and let's get to it. Okay, so we're back at Medicare.gov's website. We're going to get to the plan comparison tool the same way we got to it last time. There's another button here. You can say Preview 2020 Health and Drug Plans. That's a new thing. It brings you to this screen, but you can also go the same way we went in the previous video, just the sign up or change plans, find health and drug plan, and it takes you to the same place. Now I'm going to do continue without logging in because I'm not trying to put in specific stuff for me. I just want to give you a general overview so you can put in stuff for yourself. Now you can see up here at the top, you're previewing 2020 plans. Starting October 15th, open enrollment begins. You can enroll in 2020 plans. You can't enroll right now. You can just look at them. But as of October 15th, you can enroll. We don't want to go back to 2019 plans. We already did a long video on that. But so, what type of coverage are you looking for? Here, you really just look at one at a time, either the Advantage plans or the Part D plans. But you can look at some and pull them up in the comparisons, and then go back and switch to the other type and pull those up in the comparison. So you can still compare side by side, but we're going to just look at Medicare Advantage plans to get an overview. It works the same way with drug plan Part Ds, but we're not going to go through those because, it just matters what drugs you put in. So enter your zip code. We're going to pull that up there. I'm going to say I don't get help from any of these programs because I don't want it to try to limit any of my searches. Do you want to see your drug cost? Yes, I want to see my drug cost. Great. So it's excited. The tool is very excited. But I'm going to go to retail pharmacy here. Next. And just begin typing my drugs. We're going to do this the same way we did it last time. So like lisinopril. Click on lisinopril. Add the drug. Choose a dosage, 20, 10, 5, 40. We're going with 40. Quantity per month, 30. Frequency every month. We can do 2 months or 3 months. It's a little easier to do every month just to get an idea, even though a lot of your medications may get filled every 3 months. So we're doing 30 every month for this tool. Add this to my list. Then I'm going to add another drug, which I can do here or here. Add another drug. Let's go with Xarelto. Add this drug. We're going to say 20 milligrams, 30 a month. Add to my list. So now I've got 2. I can edit dosing and stuff. I can remove drugs just like with the old tool. Now let's add more drugs. I'm going to go ahead and just make us a list of drugs here so we can get a good idea from the tool and the prices. And we're going to go with this list now. So now it's going to have us choose a pharmacy. We're going to go with a Walgreens again. And now it pulls up the Advantage plans available. There's 23 Advantage plans available in my area. Kind of gives you a breakdown of what some of them are. This is a WellCare plan. It's an HMO. It has no deductible for the health plan, no deductible for the drug plan. The drug deductible for 2020 is $435 typically. That's a little higher than last year, but a lot of plans won't have a deductible. Some of them will. But this just kind of gives you a look. $6,000 is your in and out of network, out of pocket max for this plan. This is looking at medical side. Going to see your primary doctor is going to have a 0 copay. Seeing a specialist is going to have a $45 copay. We can look at the drugs here, which we will in the comparison tool. Estimated yearly drug cost $910.15. That's actually pretty good. So we're going to add this to the comparison list, and then we're going to pick a couple others. It's another HMO. Let's go down here a little bit farther. farther, let's grab this one, and then a PPO, which is a preferred provider plan. We're gonna add that too. That's the type of plans that typically will have a provider network that you have to choose from. And we're gonna hit the comparison tool at the bottom. So this will show us the 3 plans we chose. You'll see they all have a 0 premium here. Zeros all around. Deductibles, 0, 0, 0. I really wanted to get one with the deductible. Well, that's okay. The deductible, like I said, $435. It's not going to change a whole lot if it's not showing a deductible here. So we're going to pick one of these plans, take a look at it. Plan details. Now this is going to break down the details for you. You're seeing again the premiums, the health plan premiums. Let's scroll on through. Estimated total yearly cost for care, $36.06. This is for good health. Remember that from the last tool I showed you on the last video, you can change the health status, but for people in good health, which is, you know, not excellent but not poor, that's the estimated yearly cost for this plan. So this is one of the important things that these comparison tools can help you do, is break down really what they think you'll end up paying through the year. Now obviously it's an estimate and that can change a lot, but I mean it's a really cool thing to have that there. Out-of-pocket max is $3,700 in network. Shows you your copays, specialists, shows you some of the procedures, breaks down. Now, this is not comprehensive. There's going to be more stuff there that you can get more details on from the plan. I'm just showing you that all that's there. We're actually going to roll down a little bit. Some of the extra benefits. Now this is what you don't get with original Medicare. Hearing, dental, vision. Extra benefits. Now we're into the drug coverages. This is really what I want to show you with this plan tool. What we have is a breakdown of the prices. Now this is the retail cost column. This column here, retail cost, everything below that. This is the basically negotiated rate with the plan and the pharmacy for these drugs. So they've negotiated a cost of this drug for a 1-month supply to this. Now this is the plan's cost. If you were to pay cash for this medication and have no insurance, that's going to be higher. It's going to be more than $281. But the plan is negotiated with the pharmacy, and they're saying, hey, we're going to give you a contract rate with this of $281. That's what we've negotiated. So the factors with Medicare are going to base on this contract rate, not the actual cash cost of the medication. So if you ask the pharmacy, what does this cost if I'm paying cash, it's going to be a lot higher than $281. So the percentages of cost that you share with your plan is going to be a lot less than the actual cash price would suggest, because you're looking at the contract rate, not the cash price. And you see this one, you know, Lantus is pretty expensive. Contract rate's $182. Cash price of this is going to be several $100s. So it's, you know, just even if you're not using your plan to pay for your medication, the contract rates that your plan gets you are a lot cheaper. So it's a good idea to use your insurance, even if you feel like it's a deductible and it's expensive and they're not covering it. Still use your insurance because you're getting a cheaper rate. So that's the plan. So after you meet your deductible, which with this plan you don't have a deductible, here's your cost on these drugs. This drug, no copay for you. This is at retail, so no copay on any of those. Lantus is going to cost you $45 copay. It's a higher tier. That's why it would have a higher copay. Now I'm seeing why this plan is pretty good. There's not a lot of copays. It covers your drugs pretty well. Now your cost in the coverage gap. Now let's talk a little bit about the different phases in 2020. Some things have changed. The coverage gap has actually gone away. In 2019, during the coverage gap, if you were to get a brand name drug, basically you were responsible for up to 25% of the cost while in the coverage gap, and for generics up to 37% of the cost. In 2020, it has all equaled out. Now you're supposed to be responsible for up to 25% of the brand and 25% of the cost of the generics, which is actually the same rate that you pay after you meet your deductible, or if you don't have a deductible before the coverage gap. So basically you enter the coverage gap, but nothing should actually change unless there's other factors in the plan that cause that to change. Now, your tier 1 and tier 2 generics during your deductible phase, if you have a deductible in your plan, probably won't be affected by the deductible. You'll probably still get a really cheap rate, somewhere around a couple dollars or something like that. And then your more expensive ones like these, Lantus, Xarelto, that are higher tier, those will probably be what you pay the deductible in. So you might go get a couple of medications and they may be really cheap, and then you may get another medication and it's really expensive, and that's because your deductible is applying to that drug. Now, after the deductible's met, you have the initial coverage level, and that's where you're paying up to the 25% cost on brands and generics. Then you hit the coverage gap, which technically would happen at $4,020 of total drug costs for the year, but there's not really a coverage gap anymore, so nothing changes at that point. But then once you reach $6,350 in total drug cost, and that means your cost plus your insurance's cost on these drugs. So basically adding up the cost for the contract rate. So $182.24 and all of these added up. Once you keep adding those up until they hit $6,350, that's when you hit catastrophic coverage. Now during that phase and through the rest of the calendar year, you will only be responsible for 5% of the cost of your drugs. So that's where you sort of get out. Now when I'm looking at this now, I'm questioning if they've updated everything on this tool, because things are changing in the coverage gap, which normally would not if the coverage gap were actually gone. Learn about more coverage phases. Coverage gap. Don't hold. 37%. Okay, yeah. This was 2019's information for the coverage gap. So this may not have updated. These costs may not be totally accurate. You might actually pay less than these estimated costs, because I think they're still estimating with 2019's coverage gap. So this could be, your cost could actually be even cheaper than that. Yeah, it's telling you here that with these estimates, you'll enter the coverage gap in June, and you'll never actually exit it, because the costs of these drugs on this plan just aren't that high. And I think I'm actually going to edit this drug list here so that I can show you what will happen. And this is what you can do too. I guess it's a good time to show you. Go to your drug list, my drug list down here, and you can edit or remove drugs. So I'm going to edit drugs, and I'm going to add another drug. I'm going to add something expensive, or sort of expensive, so that I can get a good reading of what happens coming out of the coverage gap. Let's tack 2 on there just to make sure we do that. Let's throw on, not that this drug's really all that expensive, but hey, let's do that. I think it'll still work. And now we're going to compare these. I'm going to take a look at this plan again. Scroll down. See our drug cost. Alright, now since I added those, it's saying I'll enter the coverage gap in April and I'll exit the coverage gap in November. So what it's showing me here is prior to April, these are my costs. Then I'm in the coverage gap all the way till basically October for full month, and then I would enter catastrophic coverage in November and be full catastrophic coverage in December. So you see how much cheaper December is than January, February, March. And that's because you're in the catastrophic coverage where you pay such a small amount. If you look cost after the coverage gap, oddly enough, some of these do seem to cost more, but your expensive medications, like the ones I just added, the Symbicort, that cost you $42 before the coverage gap, $85 in the coverage gap, goes down to $17. This goes down to $22. So that just shows you that the costs do drop. But like I said, I think this is a little bit not updated, because I don't really think that those should change that much as you go through what would have been the coverage gap. I think this actually will probably be closer to the amounts that it was before the coverage gap. So just take that with a grain of salt, that it may be estimating your drug cost higher than it really should be, but that should at least help you get a look at it. You can still get the contact information for these plans on here so that you can contact them, ask them questions, and I do recommend that you do that so that you can clarify anything that you do have a question about. But really, everybody should get on here and try to look at new plans and try to figure out what you need to do, because you can save a lot of money by just looking at this each year, especially as medications change or your healthcare needs change, and trying to find the best plan for you at that time. So that's all I'm going to show you here. All right. So I hope that helped you out. Hope it was a little more concise this time than the last video, not so long and drawn out, a little easier to use. And hopefully Medicare doesn't throw any more loops and change anything else. But there's the tool for you. It should show you how to put your drugs in, look at the prices, get a good idea of what plan maybe would be the best for you. October 15th till December 7th, that's open enrollment. That's when you need to look at it. Even if you've already got a plan, it's really a good time to just look and see if there's a better plan, because it really can change every year. So it's a good idea to do that. All right, so if you like this video and it helped you out, if you could just hit that like button. And if you'd like to see more videos, maybe learn some more things, go ahead and subscribe too. There'll be more videos coming out. And if you've got something you're wondering about or want to know about, just leave it in the comments below and I'll check those out. All right, see you next time.